Native TV presents Maternity Voices.
Issue of support, psychosocial support for service providers. Because in Kamuli and Iganga, the midwives and the nurses there raised it. And one of them spoke so passionately about it. She said, and I quote, that we have some of our colleagues who have totally broken down. We've had to give them the medication and the treatment and send them home. But guess what? Because we are overwhelmed by the numbers of patients that we receive, once we check on them and we feel that they are up to running and their voices and energies are coming up again, instead of leaving them to stay home for 60 days to rest and recuperate, we recall them in a span of a week or 2 weeks. And when they come back, they fall in the same environment that caused the trauma in the first what? In the first incident. So she said, but for us to do that, it's painful, but we don't have a choice. Because either they come back and relieve us of the stress and the burden, otherwise more of us are going to break down. That is our reality. So these are some of the issues for me that give me red flags that in this framework, which we call a partnership that works framework, it's not about pointing fingers. It's important for us to acknowledge our responsibilities, but it's also important for us to ask the fundamental question: where do the roles and responsibilities lie for each and every one of us as stakeholders, including the service users? What is it that the community is supposed to do to help us serve them better? Within our limited resources, within the opportunities that are available. What about the community leaders? What is their role? Because, ladies and gentlemen, we can spend the whole day here creating scenarios, okay? You've heard of mothers expecting to deliver their babies who've died on entrances of hospitals, okay? But ask yourself this question: why is it that a mother who is expecting a child in 9 months cannot raise the basic financial means to buy a basic kit? Because in Kamuli again, one midwife told us that if a woman comes to me and they don't even have a pair of gloves, how am I supposed to help them? Half of the room was divided because everyone was looking at her like she's heartless. I wouldn't touch her, I wouldn't do this, okay? But part of us were asking ourselves, where do we really live in this world where our health facilities cannot afford gloves for expectant mothers? And we said, okay, take that and put it aside. How much is a pair of gloves that this woman cannot afford? So sometimes when we are discussing our reality, here is the truth. When we talk about issues of poverty, that is so far from our reality where we are discussing respect for maternity care. But we need to have that ability to cast our net wider to understand our issues. Because, ladies and gentlemen, people within our communities are poor. I don't think if a woman had a choice in this country to go to the best hospital where they can even massage them, put very nice music, they would go to a poor facility. They would all gravitate to the good what? To the good facility. Alas, if they have a role to play in terms of promoting a conducive environment within which they can deliver babies and enjoy the care, they must be in a position to provide something towards that. But our reality says different. When you go up country, and fun enough, when you even come into these suburbs in Kampala, you find seriously poor people, but then they turn up at the hospital. So this is when you open up your mindset and thinking and you say, okay, within all this, what do we do? Otherwise, if you deal with the issue from where you're standing and you don't want to look further, sometimes you might be bombarded with all these challenges and you have nothing to do with them. And as much as you try working on them, it could be that they just keep amplifying and amplifying and amplifying.
Maternity Voices is brought to you by Native Voices International in collaboration with White Ribbon Alliance, WRA Uganda, thanks to support from USAID through East-West Management. No woman should lose a life while bringing a life to this world. In Uganda, the high maternal mortality of 326 by 100,000 deaths is preventable if all necessary precaution is taken by, among other interventions, ensuring that all mothers make all the required 8 antenatal visits, have health facility-based delivery, are delivered by qualified and skilled health providers. Mothers are treated with dignity and respect, have access to health facilities. Health facilities are well equipped, hygienic with the necessary medical supplies, health providers are respected, and mother's consent is given before a procedure. For this to happen, we all have a role to play by exercising respectful maternity care, demanding for it, and creating awareness about it. Join us as a partner in the campaign to establish a respectful maternity care. You can start by liking this video, sharing it in your networks, and subscribing to the Native TV YouTube channel for updates on this campaign and other common good initiatives.